Grief following the death of a loved one to suicide is very different from regular bereavement. That initial sense of shock which a person feels is staggering. Along with that, there is that never-ending question, why? Like, why did the person do this? Also, because the bereaved doesn't want to really talk about that they've lost the person due to suicide, they kind of shun interactions with people, and also others find it very difficult to talk to the person who is bereaved about suicide. So one reacts to bereavement in different ways. You have physiological or physical symptoms and you have emotional symptoms. So the physical symptoms are the usual hollowness in the stomach, a feeling of emptiness, heart beating fast, a sense of fatigue, lack of sleep, etc. The emotional reactions are varied, right from initial denial to anger at themselves, anger at the person who has decided to end his life. Then along with anger, sometimes there is also a sense of relief. The relief comes especially in cases where there's mental illness in the family, where the person who has committed suicide has had a mental illness. Then there are feelings of sadness and depression, that I could have done something to help this person. Anxiety about how will I manage on my own. Then there is also guilt. Guilt that I didn't see this coming and I should have been the one who would have helped the person get over their depression or their suicidal thoughts. It's only after a long period of the whole grief mourning process that the person realizes that this is not due to that one event, and it was a series of events which led the person to commit suicide. Then there is shame. What shame does is it makes us stop reaching out to people. It makes us go within ourselves, and that adds to our isolation. The grief responses in different people is different. So one can have only one of these grief responses which I spoke about, or can go through several different phases. Also, what happens is that in families, everyone is in different stages of grief in a family. So if one person is depressed and one person has reached the acceptance phase, the one who is depressed feels that the one who's reached the acceptance phase has moved on and is not grieving for the deceased person. All these emotions are normal emotions, and it takes a little time, and for different people, different times for them to get over this bereavement. In fact, the bereavement attached to suicide is a far more serious and prolonged bereavement compared to other grief reactions.